look at basic indicators like child survival, maternal mortality, important indicators like that, and you put quite a few of them together, the countries in our region that came out as comparable or with better indicators were number 1, Rwanda, and number 2, Malawi. And then when you look at their expenditure, both of them per capita expenditure is about half of ours. I think Rwanda is about $50, Malawi is about 40. So you begin to see the same things, that it is not necessarily how much you spend. The qualitative outcomes of health care and the input-output of health care is not that obvious. There is a black box of what the relationship between inputs and outputs is. So that, for example, those of you who have followed the conversation in the United States about healthcare reform, Obamacare, and all of that, you will know that the US has very, very expensive healthcare system. One of the most expensive healthcare in the world in terms of cost per capita, the cost of health insurance and that kind of thing, and the expenses. It's very, very expensive. But it is, and for that reason, it provides some outstanding, some of the world-class care, but it leaves very many people behind. I know that because I have paid hospital bills for people in the US who didn't have health insurance, relatives, friends who didn't have health insurance, and ran into some, including my own sister who had an accident and didn't have health insurance and had to pay health bills in America from here. So that she could actually take time off work and get sort of care. Because if you don't, either you work, or if you don't work, you can't afford care. And there's a bit of a problem. So you get to see how dysfunctional even a system of a very wealthy country can actually be.
Iwapo unapenda habari nazokuletea, basi subscribe kwenye channel hii ili uwe unapata uhondo kila wakati. Shukran.